Hi everyone, I'm Dr. Xiong, a practicing cardiologist in Ontario, Canada. I refer many of my patients to do a sleep study. Some of them ask me why is this test necessary. In this video, I'll explain how disordered breathing during sleep can affect the heart and potentially increase the risk of cardiovascular disease. The main reason I send a patient for a sleep study is to determine whether they have obstructive sleep apnea, commonly known as OSA. Next, let's look at why OSA can increase the risk of cardiovascular disease. When we fall asleep, the muscles around the throat naturally relax, especially during deep sleep. In some people, the upper airway is already relatively narrow, as the tongue and soft tissues at the back of the throat collapse backward. They can partially or completely block the airway. This may cause loud snoring, or at times complete pauses in breathing. In OSA, the upper airway repeatedly becomes partially or completely obstructed. Although the body continues trying to breathe, air cannot flow normally into the lungs. As a result, the oxygen level in the blood drops intermittently. When the airway reopens, the oxygen level rises again. Throughout the night, the body repeatedly goes through cycles of low oxygen, followed by reoxygenation. Each time, the oxygen level drops. The brain interprets it as an emergency and activates a sympathetic nervous system, also known as a fight or flight response. Imagine suddenly encountering a bear in the wilderness. Your fight or flight response would automatically switch on, causing your heart rate to increase, your blood vessel to constrict, and your blood pressure to rise. In OSA, these changes do not happen only once. Depending on the severity of the condition, they may occur dozens or even hundreds of times every night. Instead of resting and relaxing during sleep, the heart and blood vessel are repeatedly placed under additional stress. Over time, this may increase the risk of high blood pressure, heart rhythm disorders such as atrial fibrillation, heart failure, heart attack, and even stroke. OSA is therefore not simply a problem of snoring or poor quality sleep. It places additional strain on the cardiovascular system, and over the long term, the compounding effect can increase the risk of cardiovascular disease. The good news is that OSA can be diagnosed with a sleep study and can be treated. Early detection and the appropriate treatment may help reduce long-term strain on the heart and blood vessels and lower the risk of cardiovascular disease. Thank you for watching. This video only provides general medical information, and it is not a substitute for personalized diagnosis and treatment advice from your health professional. If you find this video helpful, please like and subscribe.